All right, guys, I want to thank you for joining me today. For today's Poop Tip Tuesday, we have a great show tonight. We're going to discuss about maybe the one breakfast food you should consider eating, or maybe you shouldn't be eating. You'll get into it. We'll talk about L-glutamine and is it good for leaky gut or IBS. And we'll talk about Colon Cancer Awareness Month. It starts tomorrow. Answer your questions pretty much the whole day. And I'll go through a lot of topics in the next month. If you're joining for the first time, my name is Dr. Islam, and yes, I am your poop guru. I am a board-certified gastroenterologist trained at the Mayo Clinic. My passion every Tuesday is to give you the best tips and tricks so you can live your best life from the top all the way down to the bottom. If you haven't already, don't forget to smash that like button. Like, share, and subscribe. Unfortunately, it's the only way people know that we're actually doing something. The more likes that you do, the more you subscribe, the more you share, the more the social media giants let people know what we're doing. And if you haven't already, let me know if you're watching this live or on the replay. And also let me know where you guys are watching this out. Every week, I like to get a contest to see where the furthest person is who is watching our live show. And last week, we had a winner from, I think it wasn't that far. It was in the U.S. We've had people from Antarctica. We've had people from Japan. And so I'd love to hear where you guys are watching this at as well. Jericho, it's good seeing you. Thank you for watching on the live stream as well. So a couple of things. Number one, how are you guys surviving the dust storm that was here in Lubbock? Oh my goodness. My allergies are killing me. I have never seen a dust storm like that. If you're not from here, I want you to picture pretty much the whole sky red. It was like Mars. It was nuts. I barely went outside because I don't know why. I wanted to experience what it was like. And let me tell you, that was miserable. I literally went outside for like 5 seconds. I had all this dirt came in me. In fact, did you know this shirt was actually white before I went outside? Now it's brown. No, I'm kidding. All right, that's not true on that. But I went outside. It was crazy. I got dust all over me. My allergies are acting up. It is pretty nuts. Every week, I also like to go over the books I read last week. My goal in 2023 is to try and read one book a week. And I try to see if I enjoy reading. It's one of my passions. And I also just want to, it's what I do. And so last week, I read this book. The Discipline is Destiny. It's from Ryan Holiday. I'm a big fan of Ryan Holiday's books. I've read pretty much every single book he has. He's going through kind of a 4 virtues book, and I am a huge fan of his book. It was a really good book. I have found that for me, discipline has been a critical factor for me to be, to get the goals where I want to get. To help me achieve the goals, help me get where I want to be, and also make sure that I achieve what I want to both personally, professionally, and family. It was a very awe-inspiring book. I loved it. Let me know in the comments down below if you've read this book or if you have another book you recommend as well. So every week I try to finish one nonfiction book. I also read a fiction book because fiction is how I go to bed. And what I'm reading, David Balducci, The Hour Game. I love these books. I love these crime books. I'm obsessed with these. I don't know why, but I just love it. It turns my mind off. I don't have to think about anything else. And so I try to read a fiction book at night to help me sleep. I try to read at least one book a week. Let me know in the comments down below if you have any good recommendations for books you want me to read as well. All right, a couple updates before we begin. Number one, tomorrow is March 1st. I think it is. Well, it should be soon. March is Colon Cancer Awareness Month. The whole month, we'll be doing a lot of posts, a lot of information, a lot of lives on colon cancer awareness. Our job this month is to make everyone aware of the second leading cause of cancer death, which is colon cancer. My job as a GI doctor is to make sure that as many people can get screened so they don't develop this problem. The worst conversation I ever have with a patient is telling them they have a cancer that could have been prevented. And a week ago, I unfortunately had this conversation for an individual who kept on delaying their colonoscopy until they actually had symptoms. And that individual, we did the colonoscopy, we found a massive cancer in the colon. Colon cancer is 100% preventable. If you're 45 years or older and you've not gotten a colonoscopy, get your colonoscopy done ASAP. If you're having symptoms, get your colonoscopy done as well. We'll be doing a lot of posts on that, and in my live video today, I'll be talking about that as well. And then lastly, I did a talk to the Nurse Practitioner Association about hemorrhoids. Yes, hemorrhoids, everyone's favorite topic. Listen, we do a lot of options, a lot of treatments for our patients. Hemorrhoid treatment for me is one of the best treatments I can offer my patients because it's quick, it's easy, it's virtually painless, and it resolves that annoying issue in your bottom. If you want to learn more about this, go to my webpage, lubbockgastro.com. We can give you more information on that. All right, let's begin today's live video. So if you're joining for the first time, let me know in the comments where you're watching this at. Give me a question you guys want me to answer. I'll try to answer those questions during today's live stream. Question number 1, Dr. Islam, I eat breakfast. What is the one breakfast food I should be eating? Now, I practice intermittent fasting, meaning I don't eat breakfast. And so I'm not a big fan of breakfast. And if you look at all the research when it comes to eating breakfast, there's a common myth out there that you should be having breakfast. It's the most important meal. Guess what? We have no evidence that's the case. And so if you're like me, what do I recommend when it comes to breakfast? Well, the best thing you can do, to be frank with you, is to have a black coffee. Very important. A number of different reasons why. Number 1, that coffee has been shown to stimulate your bowels. Not only does it wake you up, it stimulates your bowels. So if you have issues with constipation or bloating, that cup of coffee that you have in the morning induces what's called the gastrocolic reflex. So things go into your stomach and boom, it moves things through the small intestine into the colon to allow you to have a bowel movement. I'll give you a quick little secret from Dr. Islam here. I poop awesome after I have my coffee. Yes, I'll admit that I totally do. This is how I have my bowel movement. And by having that coffee, it stimulates what's called the gastrocolic reflex to allow that to happen. Number 2, black coffee has been shown to be so beneficial for a lot of conditions inside and outside your gut. It can decrease inflammation in your body. It can decrease your risk for developing fatty liver disease. And can also reverse some of the issues that come with constipation or irritable bowel syndrome as well. Number 3, black coffee also has a lot of antioxidants to help decrease the bad effects inside your body and can change your gut microbiome to better as well. For a lot of my patients who have issues with their gut microbiome, by introducing black coffee, they're able to change their gut microbiome, make it better, and hopefully resolve some of their gut issues as well. The important thing about black coffee, and I keep on stressing this, it is black coffee. So it's not your frappuccinos. It's not your coffee with whipped cream and sugar and milk. Unfortunately not. All the studies are strictly with just black coffee alone. So in my opinion, this is the number 1 thing you should be doing, whether you're intermittent fasting or you're not intermittent fasting, is having that black coffee. It works. It's effective. It is my secret sauce to help you poo. All right. If you're joining for the first time, my name is Dr. Islam. Every Tuesday, I go live on my social media streams. I want to know in the comments if you're watching this live or on the replay and where you guys are watching this at so far. So far, we have Nova Scotia. We have Ann Arbor. Oh, Cora, Ireland. So far, you are the winner. I am so excited. That is so far number 1 that we have so far. So I am so happy about that. Shiva, thank you for watching on Round Rock as well. So I appreciate that as well. Let's go through some questions really quick. All right. So Kyla asks, I've started my SIBO treatment, but I am not having to kill off phase. Does that mean the medicine is not working? Very good question. So SIBO, what is it? SIBO is small intestinal bacterial overgrowth or overgrowth of bad bacteria in your small intestine. And there are a couple of symptoms this can present with: bloating, nausea, diarrhea, and constipation if you have a specific type of SIBO. There are a couple different ways we can test for this. We can do what's called a breath test, where you breathe into a machine. We can see how much bad bacteria that's there. We can also get samples of your small intestine to look at it on the microscope to see if there's an abnormal growth, or we can diagnose it clinically. If I see you in the office and I think that you have SIBO, I can give you treatment to see how you feel. Now, you bring up a very good question, the kill phase versus not kill phase. This is very controversial. I'll be honest with you. A lot of functional medicine doctors say that you have to have a kill phase where you have all these symptoms that occur from that. We don't have a lot of good evidence that that's the case. Here's what you need to know is that the treatment for SIBO would depend on if we actually think that you have this or not. We give antibiotics to treat that, and your clinical response to that can be our recognition that you have this particular condition. It can take up to a month for us to know if you have a good clinical response with this medication. The other thing I have to stress is I want to make sure you're on the right treatment for SIBO, because there are a lot of things out there on the internet that are not true when it comes to SIBO. SIBO is one of those big myths I see everywhere, which a lot of people have an opinion about, but a lot of people don't have the science or the education about that. So be very careful about what you're treating with, and if you actually have this condition. That's a great question that you're asking today. Perfect. All right, Dr. Islam, question number 2 that I got. What are my thoughts on using L-glutamine for leaky gut or IBS? Let me know in the comments down below if you've wondered about L-glutamine. Have you tried L-glutamine, or have you tried other supplements when it comes to leaky gut or IBS? So let me tell you exactly what this is. So L-glutamine is an amino acid that does play a role in terms of the lining of the gut health. It can help out with the lining. It can help out with inflammation. It can also help out with the repair of the GI tract as well. And we do have some evidence that L-glutamine can help out with that mucosal barrier that we think could be impaired with some GI conditions. And we can see in some individuals that taking L-glutamine can help reduce some of that risk of having that impaired lining inside the GI tract. Now, what I stress with all supplements is that you need to speak to your healthcare provider first before you implement any type of supplement, because not everyone should be on a supplement, and not for everyone is the supplement good for you. Keep in mind, it is a supplement. It is not the mainstay of treatment. It comes to diet, lifestyle, stress reduction, food, sometimes traditional therapy, and then we can add a supplement on top of that. But if you're not doing the other things first, no amount of supplement is going to help out. But I've seen some evidence when it comes to using a supplement, especially L-glutamine, to help out with gut issues. And for some individuals, I would recommend to maybe consider this and maybe speak to your doctor about this. There are a couple of different dosages that we recommend. Sometimes you can start off as little as 2.5 grams per day, and you can titrate it up to as high as maybe 10. But once again, you always need to make sure you speak to your healthcare provider first before using a supplement like this, because it should not be used for everyone, and only for people with certain conditions, and people who don't have certain conditions it would benefit from. All right, once again, if you're joining me for the first time, my name is Dr. Islam. Every Tuesday, I go live on my social media streams. If you haven't already, don't forget to smash that like button. Like, share, subscribe. If you know somebody who's had gut issues, share this video with them. This is the only way that we know that, unfortunately, the social media giants know that we're doing something. If you haven't already, let me know if you're watching this live or on the replay, and let me know where you're watching this at. So far, Cora is the winner from Ireland. Let me see in the comments down below if there's somebody else here who is further from that. All right, so Maggie asked the question, yogurt. Is yogurt good for you? Very good question. So yogurt actually can be a very effective medical option when it comes to gut issues. Yogurt has a lot of benefits as probiotics. It can have prebiotics. It has live culture, and also has the minerals that are good for you. Here's my recommendation. Try to find yogurt that has active live culture. Try to find a yogurt that is low sugar, has no sugar, and try to have a yogurt that has a high protein content in there as well. A lot of yogurts are supplemented with a lot of sugar and a lot of additives and a lot of ingredients that are not good for you. It counteracts the effect that you're trying to get by introducing more good bacteria inside your gut. So just be careful of that. But these are the kind of the guidelines I have when it comes to yogurt. The best response is try the yogurt, see how you feel. Keep in mind that you may be lactose intolerant, so you may not be able to absorb the yogurt as well as you would like it. If that's okay, it's not a problem. You can certainly stop that, or maybe see if you can try a lactate supplement to help out with that. Great question. All right, Robin. Robin's the winner. Australia. All right, Robin. Great job. You are now the winner of the furthest person so far. Maybe I should do a giveaway. I don't know. Let me know in the comments down below if you guys want me to do a giveaway for the person who is able to tell me the furthest of where they're at. I want to see. It's not a bad idea, so it's really good. All right. Perfect. So it's a good question from the Chick Planet. Regarding colon cancer, if a parent had colon cancer, how much is the risk of percentage that offspring would get this? Very good question. So you bring up a very good point. Family history is critical when it comes to the risk for colon cancer. The biggest risk factor are those who have a first-degree relative, so mom, dad, brother, or sister. So I will tell you, if you have that, you are at a substantially higher risk of developing colon cancer, and usually recommend to get a colonoscopy at least 10 years before the age of diagnosis. So if your dad was diagnosed at the age of 50, you should at least start your colonoscopy at the latest at the age of 45. So for sure, you are at higher risk. Know your family history, because that family history is critically important to understand what your risk factor is going to be. And if you know that family history and you have that risk factor, get your colonoscopy. You can save your life. Great question. I'm glad you asked that. All right. Shiva asks, how does removing your gallbladder affect your digestive system? How does one compensate for missing a gallbladder or bile? Great question. Shiva23, I actually have a video on this on my YouTube page, so if you want to go there, I have more information on there. But basically, your gallbladder is an organ to store bile. That's what it's there for. And so when you have your gallbladder, that organ just stores bile and it keeps it in there and releases it whenever you need it. So for example, if you try to digest food or fats, that's when you're going to release bile. When you lose your gallbladder, guess what happens? You lose the storage place of where the bile is going to be. So bile will go two places. It will go up into your stomach to what's called bile reflux. We have a lot of pain and indigestion that may not get better with acid medication. Or it can go into your colon to cause diarrhea. It's called bile acid diarrhea. And there's some things that we can do naturally to help out with that. Sometimes ox bile over the counter can help to absorb that bile. Sometimes adding fiber can help out with that bile. But more often than not, we'll have to give you a medical option that can hopefully bind up the bile. They're called bile acid binders. It works fantastic to help out with both upper GI issues and lower GI issues to get you feeling better and to resolve those symptoms. Great question. It's a very common symptom that people get after they get their gallbladder removed. Great question on there. Guadalupe, thank you for watching. So James, thank you for watching. Good question. Can Crohn's disease cause prostate problems? Typically not. The only time it could is if for some reason you can develop what's called a fistula, which is a connection between your GI tract and your prostate, which is unfortunately a common occurrence when it comes to Crohn's disease. I have a video when I review Mr. Beast's Crohn's disease on my YouTube channel, just went up I think last week, and so don't forget to go to that particular video to get more information on that. All right, perfect. All right, next question I got. Hey, Dr. Islam, I have a question about colon cancer. What can I do to prevent colon cancer? Well, since tomorrow or this week will be Colon Cancer Awareness Month, I want to go into this particular question because I think it's very, very important. So colon cancer, like I mentioned before, is the second leading cause of cancer death in the United States, but it literally is the most preventable cancer that's out there. The best way to prevent this is to get a colonoscopy by far. This is the most effective way to find precancerous polyps and remove them at the exact same time. This is what we're going to do. Now, I know people are kind of freaked out about getting colonoscopy. I understand that the worst part is that prep, but the preps are better. They're less intense, and they get the job done. That's the hard part, is that. The easy part is getting the procedure because you're asleep. It is the best step you'll ever have. But here are things that you can do today to prevent colon cancer. Number one, really learn to change your diet. We know that diet plays a role in developing cancers. We don't know the specifics behind this, but we know there is a change going on in the gut microbiome. Next week, I have a newsletter coming out on this particularly. So if you haven't already, don't forget to subscribe to my newsletter, SamirIslam.com, where you get more information on topics like this. Number two, we do know that inflammatory foods increase your risk for developing colon cancer. So a lot of meats, a lot of processed foods, a lot of red meats will increase your risk. Number three, we know that obesity, being overweight, will increase your risk of developing precancerous polyps and developing colon cancer. So as much as you can, if you can minimize that weight, get to a lower weight, that's going to help minimize your risk. Number four, like I mentioned before, family history plays a significant role when it comes to developing colon cancer. So know your family history. Mom, dad, brother, sister, when they got polyps, if they got cancer, at what age. This is critical for your doctor to know what's going on. And then lastly, the most important thing you can do is to get a colonoscopy. Don't wait. Don't be a statistic. Get one at the latest starting at the age of 45. It may be earlier if you have symptoms, or it may be earlier if you have a family history that had a early onset colon cancer. These are 5 things I recommend that everyone should do to minimize or decrease their risk for developing colon cancer. So don't be a statistic. Get this done. Save your life. All right, guys. I want to thank you for watching. If you haven't already, don't forget to smash that like button. Like, share, and subscribe. Also, let me know if you're watching this live or on the replay and where you guys are watching this at. So far, the winner is still Australia. So great job on that, Robin. I'm gonna see. I'll write this down really quick. Robin. So you're the winner so far. But let me know if you're watching this live on the replay. Also, let me know in the comments down below if you have a question for me to answer in future live videos. We go through these comments. We try to answer questions. We try to get them and answer them in future lives and make future topics on them as well. Smash that like button. Like, share, subscribe. Hope you guys have a happy day. Hope you guys stay safe, stay warm. And don't forget, guys, let's talk about poop. See you guys next week. Thank you so much for watching and have a great day. Thanks, guys.